Okay, if you're a dental student, you know this feeling. That pressure of a practical exam, the clock ticking, the standards that feel impossibly high. And through it all, there's that one question that's just rattling around in your head.
Yeah, this is it, right? This is the big one. How do I get faster? How do I build that clinical speed so I can be precise and confident when everything's on the line? Well, here's the thing. The answer might not be what you think, because the goal isn't really to be fast at all.
And that brings us to this really crucial idea. See, rushing, that gets you absolutely nowhere. It just leads to mistakes, which means you have to go back and correct things, and you just lose time. True speed, let's call it clinical velocity, is the natural result of being incredibly efficient. So let's dig into how you actually build that efficiency.
All right, first things first. We have to completely blow up this myth of speed. That instinct you have to just, move your hands faster, it's a total trap. It just leads to sloppy work, and weirdly enough, it actually slows you down. The real secret? It comes from a principle used by people who operate under the highest pressure imaginable. We're talking elite surgeons, special forces.
And here it is. Slow is smooth, and smooth is fast. Think about that for a second. The key word there is smooth. What does smooth mean? It means every single movement you make has a purpose. There's no wasted motion. It's about having a plan so clear in your head that your hands just execute. No hesitation, no errors, no going back to fix stuff. That is where real speed is born.
Okay, so how do we get there? How do we build that smoothness? Well, to get that kind of efficiency, you've got to build a rock-solid foundation. And look, this isn't about some magic trick. It's about mastering 3 universal pillars that are the bedrock of all high-level dental work.
And here they are, the big 3: mindset, body, and system. Simple, right? First, your mindset, having that crystal clear picture of the final product. Second, your body, putting yourself in the perfect position for precision and control. And third, your system, having a repeatable, step-by-step workflow for everything you do.
All right, let's dive into that first pillar, mindset. Think about it like this. Before a single burr even touches that tooth, you have to see the finished product in your mind's eye. And I'm not talking about some fuzzy, vague idea. I mean a detailed, 3-dimensional blueprint. When you know exactly what you're building, your hands just know where to go. They can move with confidence and purpose.
And this slide just nails the difference, doesn't it? Look at what rushing looks like. You're making these hesitant, feather-light cuts. You make mistakes, you're constantly fixing them, it's a mess. But smoothness, that's deliberate. It's decisive. You make the right cut the first time. There's no wasted motion, no wasted energy. That is what clinical velocity actually looks like.
Okay, pillar number 2, your body. And let me be really clear about this. Ergonomics is not about comfort. It's a physiological requirement for precision work. If your posture is bad, you're going to get tired, you're going to get tremors, and that absolutely destroys your fine motor control. That's why loupes are completely non-negotiable. You have to see the details. And you have to master indirect vision with that mirror so you can see everything without tying yourself into a pretzel.
And that leads us right into our third and final pillar, your system. This whole process starts way before the clock even begins ticking. A well-organized tray is a well-organized mind. It's a direct reflection of how prepared you are. If you're fumbling around looking for an instrument, you are wasting time you can never get back. Everything should be laid out in the exact order you're going to use it.
And a huge part of that system is your instrumentation. Look, forget having dozens and dozens of burrs. A minimalist, carefully chosen burr block like this one, that's the mark of an expert. It completely eliminates that time you waste hunting for the right burr, and it forces you to be systematic about every single step.
Okay, so we've got our foundation set. Mindset, body, system. Now we're going to make a really important shift in perspective. To really nail this, you have to stop thinking like a student and start thinking like the examiner. You have to become your own toughest critic.
The absolute key here is to get into this prepare, evaluate, adjust loop. What does that mean? It means you don't just barrel through the whole prep and then check your work at the end. No way! You prepare one feature, just one wall or one part of the margin, and then you stop. You look at it. You evaluate it against the ideal. Is it perfect? If it's not, you make a tiny adjustment. This simple habit is what stops a small, fixable error from turning into a complete disaster.
So, let me ask you a question. What's the number one mistake? The one geometric failure that's an automatic fail. We're not talking about being a little off on your reduction. We're talking about a fundamental flaw that makes it physically impossible to seat the final crown. Yep, you guessed it, I'm talking about an undercut.
And here is the simplest, most foolproof way to check for it. I want you to do this every time. Close one eye, look directly down the preparation's path of insertion, right down the long axis. You must be able to see the entire, uninterrupted circumference of your margin. If any part of an axial wall bulges out and hides that finish line from your view, you have an undercut. You have to master this one-eyed test. It's critical.
All right, so let's put this all together. Let's see how these principles, mindset, body, system, all come together in one of the toughest procedures you're going to face, the full coverage crown prep. This is where the rubber really meets the road.
If you try to wing it here, you're going to fail. It's that simple. Success demands a strict logical sequence. You always start with occlusal reduction, then you move to the functional cusp bevel, then the axial reduction, then you define your margin, and finally, you finish and smooth everything out. Following a system like this isn't just a good idea, it's what prevents you from panicking and forgetting a critical step.
And this is where you can really tell the difference between an amateur and an expert. An amateur does the same crown prep every single time. But an expert knows that the material dictates the preparation design. You see it right here. A PFM needs that heavy shoulder on the facial for the porcelain. An all-ceramic crown absolutely needs rounded internal angles or it'll fracture. And good old full gold, it lets you be the most conservative with tooth structure. One size does not fit all.
And here's a number you just have to burn into your brain. 10 to 22 degrees. That's the sweet spot, the clinically acceptable range for your total occlusal convergence, your taper. If you go less than that, you're probably going to create undercuts. If you go more than that, the crown won't stay on. Hitting this target range consistently, that is a true measure of your skill.
Okay, so we've covered the mindset, the body, the systems, all the techniques. Let's bring this all home. Let's talk about how you actually train to put all of this together so you can perform when the pressure is on. Because this is about way more than an exam. It's about your future as a clinician.
Look, training for speed isn't about training harder, it's about training smarter. First, you have to practice under timed conditions. You need to build that resilience to the clock. And second, and this is a fantastic tip from motor learning science, you need to adopt an external focus. Don't think about what your fingers are doing. Instead, focus entirely on the result you're creating on the tooth. Focus on that smooth margin, that perfect taper. When you do that, your brain just self-organizes. It figures out the most efficient movements to get the job done, all on its own.
And this right here, this really gets to the heart of it all, doesn't it? At the end of the day, this isn't just about passing some test. This is about your professional and ethical obligation. It's about developing a level of skill that you actually owe to the patients who are going to put their trust in you. The discipline, the precision you're fighting for right now, that's the foundation of their trust in you for your entire career.
So, I'm going to leave you with this one final thought, this one question. Are you just preparing for an exam? Are you just trying to get through the next hurdle? Or are you ready to start training as a craftsman? The choice is yours.